As for cases and hospitalization trends, we're beginning to see a decrease in both numbers across our communities, although the numbers still remain higher than they were earlier in the summer. So a lot of it is relative. There's been a very slow, steady decline over the last 4 to 6 weeks in hospital admissions. And some of that, I think, is because we've had a little bit less activity with COVID in our community. So in our Charlotte market, we've seen a decline in the percentage of COVID tests that are positive over the last 2 weeks from about 15% to now about 10%. In our Winston-Salem market, from about 18% to 14% of our COVID tests are positive. And in our coastal market, which includes Novant Health, New Hanover Regional Medical Center, we're seeing a percentage of positive tests that are around 12%, down from 19% or so. So we hope this translates to a continued decline in hospitalizations in the weeks ahead. For comparison, in our last briefing 2 weeks ago, we were caring for about 450 to 500 COVID-19 patients in our system in totality. Today, we're caring for 350 to 400 COVID-19 patients. In early June, we had fewer than 100 COVID-19 patients, so we're still higher than we were then, but hopefully we're moving in the right direction here. One data point that remains stagnant is the number of unvaccinated versus vaccinated patients that we're caring for in our hospital. As of this morning, 97% of patients with COVID-19 in our ICUs and 98% of COVID patients on ventilators right now are unvaccinated. So as we've said many times, this continues to be a pandemic of the unvaccinated. There are occasionally breakthrough cases, but you can still see that vaccines are holding up quite well in the prevention of hospitalization, particularly severe disease and death.